So we're going to focus on the brow position, brow proportions, and light reflection. So if you draw an imaginary line from the ala along the lateral canthus, you should end up at the tail of the brow. If you draw a line straight up vertically from the medial canthus, you should end up at the head of the brow. So this would be the entire brow length. And as you can see, our patient has already plucked a little bit of the hairs here on the lower side of the brow in order to catch a little bit light reflection over here. So especially the tail of the brow is a nice area to lift, so that the tip of the tail should be just a little bit higher than the head of the brow. And that's why normally it's aesthetically pleasing to lift the lateral brow. Now, where is that exact peak of the brow? Well, there's different theories, but the one that is, to me, the most appealing is the golden ratio theory. So this should be 1, and this distance should be 0.618. So the entire length would be 1.618, where this would be 1, and this would be 0.618. There's another way to measure that along the ala, from the ala, along the lateral limbus to that peak of the brow. So different ways to get to the same ideal point. So what we're going to do is use sharp needle injection technique, and therefore we have to be conscious of the danger zones. So I'm going to mark the supraorbital notch. Sometimes you can feel a little depression in the supraorbital rim. It's over here. So we know that from here there are arteries running upward. You can sometimes see the supraorbital crease. There's also something over here. So there's definitely arterial blood supply, and of course supratrochlear artery as well. Yeah, I think this is the supraorbital foramen, supraorbital notch. So this is one branch, and you never know exactly where the arteries are going to be. So we have to have safe injection technique. And what is a safe injection technique with the sharp needle close to the eyes? Well, first of all, if we want to catch a little bit more light over here, we can have, let's say, a subcutaneous injection technique. So from here, we can advance our needle in a subcutaneous plane and give our patient a retrograde linear thread. This is radius plus undiluted, and I'm going to check for little veins. There's a venous plexus over here. So I'm just going to start just below the hairline of the brow, introduce the needle tip, and advance the needle just below the skin, just inferior to the hairline of the brow, until I reach the peak of the brow. Then my eyes are going to go from the needle tip to my marking on the syringe, and I give a very slow retrograde linear thread, and I inject very little product. 0.025 in one retrograde. I go back and I give another 0.025. So it's 0.05 in total. Now, because of all those little veins here, we have to assume that we might bruise our patient. So we give a little bit of direct pressure immediately after that injection. And we can mold it a little bit. As you can see, there's already a little bit more light reflection over here. Let's mold it a little bit more, even it out. And you can see that the lateral brow starts to catch a little bit more light. Down until I feel the needle tip touching the periosteum. Now I feel the needle tip touching the periosteum. I pull the skin and I give a very, I'm just medial to the peak now. Give a very small bolus, 0.025. Another very small bolus, right on the periosteum of the supraorbital rim, 0.025. Small bolus, 0.025, or less even. And another bit. Again, some direct pressure. So, right here, medial head, tail, peak. All right, so subcutaneous, I will give her retrograde linear thread, and then deep on the periosteum, I will give her on the supraorbital rim a few boluses. I make sure that I stay lateral from the supraorbital notch, which is over here. And I have to realize that there might be arteries running here. So I'll start with a retrograde linear thread, bevel up, and just below the hairline, 1, 2, 3, and moving the needle in just below the hairline in the subcutaneous space, 0.025, and another retrograde, another 0.025. So in total is 0.05 injected right now, just superficial, just below the hairline of the lateral brow in the tail. Second, I will move with my bevel down, I will move to the periosteum. I start at the peak and I move straight down to the periosteum of the supraorbital rim. I keep the supraorbital rim in between my fingers to control my needle. It's not going intraorbitally, and I give a little bolus of maximum 0.025. And at the peak a little bit more, just small deposits, making sure I don't risk anything because I'm using a sharp needle and not a cannula here. And just micro deposits, keeping my finger on the supraorbital rim, controlling the needle position. Then I've injected now, I guess, even less than 0.1. So if you want to use a needle, then have a smart technique. Make sure you don't risk anything. Give your patient multiple small boluses on the periosteum away from the supraorbital notch. And that can really nicely reposition the brow, the lateral brow especially. Okay, let's have a look. You see on the left side there's already some edema that is associated with calcium hydroxylapatite without dilution, and there's just some reaction over here, and we will probably see that in the next few minutes on this side as well.